Happy World IVF Day, Doctor.
Thank you.
So, in this bowl, we have got some chits with the most asked questions from people out there. You will pick one at a time and answer it quickly. So, let's get started.
Sure. Let's see what's there. Is IVF painful? And what does the process actually involve? Well, I think this is my most favorite question the first chit that's asking, is IVF painful? No, IVF is just not painful. If I could give guarantee for one thing, I would say it is not painful. Why I'm saying that? Because there are injections. Well, the process does involve about 10 days of injection, starting from the second day. And these injections are tiny, put in the abdomen, they are subcutaneous. So that means you don't have to put in the vein or in the muscle. They are into the fat. They can't go wrong. You can do it yourself. And they are equivalent. They are same as the diabetics who take insulin before every single meal. So if the diabetics can take it before every single meal, 10 days of these injections is certainly not painful. The ovaries do get enlarged, but I don't think pain is the process that you have to worry on. After 10 days of injection, you are given a rupture injection and then you are taken to the theatre where under anesthesia, again painless, the probe goes through the vagina, there is nothing on the abdomen and the eggs are aspirated. And that is it. The pickup is done. And after 5 days, you can take a transfer. So this is the second question. What is the one thing you wish every patient knew before starting IVF? Well, I wish every single patient who comes for IVF has hope. He knows the success is 50 to 60 to 70%, but it is not 100%. And this is what I want every single patient to know. There is no guarantee. We give our best, you try your best, but there is always a chance of not achieving success. So you may have a baby, you may not have a baby, but you should not have a heart attack. So I wish every single patient, they should not get carried away with false magazines and false hoardings saying we can give 100% success. No, IVF cannot give you 100% success. What is the difference between IUI and IVF? And how do you decide which one to recommend? Well, there is a big difference between IUI and IVF. IUI is one step above intercourse. That means if a patient is young, she has enough eggs, her tubes are open, where we have checked it by an HSG, and the male factor is probably just a little bit here and there, then IUI is the first procedure to be done. Don't go for IVF straight away. Count is good, AMH is good, and fertility is only maybe just a little bit of fertility because of male. Washing the sperm will increase the morphology and the motility and the concentration of the sperm, and right deposition close to the cornua, very close to where the egg is, will attain success. Success, well, is about 10 to 15%. What about IVF? If you've had 3 or 4 IUIs and you failed, or if the tubes are blocked, or if you have severe endometriosis, or the maternal age is more, and you don't have that kind of time, then IVF is the process of choice. So we decide looking at the mother's age, the counts and the tests that have been done, the years of marriage that have gone, and the kind of morbidity that the patient carries also. So that makes us decide, and of course IVF has a much higher success rate, 50 to 60%, which is much better than IUI. So I would, if a patient is young, I would say take 3 or 4 cycles of IUI. If that doesn't work, then go to IVF. What role does the male fertility play? Is it always a woman's issue? Well, no. It takes 2 to tango. It requires both male and female gamete to be equally robust to make a good strong embryo to implant into a great soil. So it requires both of them equally. So a males, because many of the males smoke, they vape, they have hookah, they have alcohol, they have a stagnant lifestyle, and they have everything not going right for them, and their sperms get affected. I would say that it is very, very important for the males to have a good lifestyle, specifically when they are trying to conceive. At that time, eating a good antioxidant rich food, lots of fruits and vegetables, having an active life, exercise should be in their domain, and they should not be having any substance abuse. No alcohol, no smoking at all. Smoking is specifically not at all. So males have a big role to play, whether it is motility, morphology, or the concentration. All of them get affected if the lifestyle is not done properly. At what age should someone start considering fertility testing? Well, in an age, in an era where people are getting married very late, in an era where people are not considering pregnancies early, even if they are married, and where divorces and separations are going on, I would say the moment, it of course depends on what exactly is the why that you don't want to, but I would say early 30s is the time when you should start getting fertility testing. And I would say both for male and female. There are a lot of people who realize very late that the count was very less for males also. So I would say the moment you touch 30, you should start looking for fertility testing. See whether the count is very low, because if it is very low, then you don't have the kind of time, you don't have 5, 7, 10 years to wait. But if the count is okay, then maybe you can wait for a year or two and then start doing. But really speaking, I would say there are people who start getting tested very, very early also. If you are married and you are less than 35, then after 1 year of staying together, if you have not got pregnant, go and do your testing. If you are between 35 to 39, even 6 months of marriage and staying together and having regular intercourse, you should get tested. And if you are more than 40, then please don't wait at all. Day one, go and get yourself tested. Well, this is personal. What inspired you to specialize in IVF or infertility medicine? Well, to tell you the truth, it was my brother who got married and 10 years passed and they had not conceived. I saw him going to every mandir possible, doing whatever you can think of. Seeing his pain, I actually thought, my idea was to go into cancer. And there I thought, this is the field which requires so many couples who are suffering from this pain. And this can be mitigated easily. Science has developed to that level when we can create the babies outside in the lab. And I really just thought that this is the line I should be choosing. And I went and specialized into fertility. Thank you.
All right, doctor, that was so insightful. Now let's move on to the next round, which is our rapid fire, and you have to burst some myths quickly. So, first question, does IVF always lead to twins?
No, not at all. Of course, in an era where we are only putting one single embryo, we cannot have twins. Even if I put two, 90% chance of having a single implant rather than two. Of course, 5 to 10% chance of twinning is there, but then that's okay. Since we never put more than 2 embryos, so we never have more than twins.
Okay, moving on to the next question. If one IVF cycle fails, does that mean the next one will too?
Not at all. In fact, the cumulative chances of success increases with every IVF cycle. So if you have a 50% chance of having success in the first cycle, the second cycle you already learnt a lot from your first cycle, and the chances definitely increase, and they increase with every cycle.
Okay, so can you please tell me how true is this sentence that IVF is not possible after 40?
Well, now legally India's law says 50 for women and 55 for males, and we can have a pregnancy till that age, absolutely legally. Who says 40 is the last age? No, you can have if you have your own self eggs. If not, then donor eggs can be used, and you can definitely become a mother till the age of 50, what the law says.
Okay, doctor, one last question for you. So, if you could leave one message for someone who is watching this on World IVF Day, then what would it be?
I would say, lage raho munna bhai. You have to have the courage to come back after failure. Of course, you have to draw your own Lakshman Rekha, but don't give up. People give up after one single cycle and think, oh, I've done IVF, I can't do anything more. So please be on it. Sometimes it may take more than 2 or 3 cycles to get success. Of course, going to the right doctor is very, very important. Somebody who knows his works and who knows what is more recent and what else can be done now. So I would just say, come back again and again. And that, I think, is the message that I would like to every couple who is trying IVF.
Okay, and that's a wrap. Thank you so much, doctor, for your precious time.
Thank you. Thank you so much.